So, Doctor, we do appreciate your time. We want to be respectful of your time. So, and we appreciate that you agreed to meet with us. We thought it would be good for the board to kind of catch up with you on some of the more pressing public health issues of the day.
Well, I am Olivia Kasirye. I'm the county health officer, and right now I'm the one in charge of both the COVID response as well as the monkeypox response.
Wow. No pressure. So why don't we have the journalists begin asking questions, and I will open it up to whoever wants to start.
One of the things we were obviously thinking about when we thought about reaching out was just, the LA County consideration of a mask mandate. And I was wondering sort of what indicators and data points are you looking at as you, consider whether that's something Sacramento County should be considering. Maybe just peeling back the curtain a bit in terms of sort of what you're looking at right now and what would be sort of your rationale to impose a mandate or not for masking right now.
We've had that question come up a few times. The short answer is that right now we will follow the state guidance. And right now their guidance is a strong recommendation for masking. The long answer is that we've had a lot of discussions about what additional measures we can take that will help the community deal with the current surge, and looked at where we are right now compared to the previous surges that we've had and how it compares, and looking at different indicators, not just including the number of cases, but looking at hospitalizations as well as deaths. And also on the other side of that, looking at what it would take to issue a health order for masking and how effective it would be. And so as far as in comparison with previous surges, this seems to be more of a plateau right now. I think all of you have looked at our dashboard, and after the initial increase in cases, it's just remained at a plateau, and it might go up and down a little bit, but it's remained about at a case rate of 30 per 100,000. And definitely much lower than we saw with the Omicron. The other change that we have seen compared to other previous surges is that this time around, when you look at the number of hospitalizations as well as the severity of individuals that are hospitalized, as well as the deaths, it seems like it doesn't match up to what we were seeing with previous surges, meaning that the variants that we're seeing right now seem to be a lot more contagious, but people are not getting as sick. And that could be due to two things. One is we have a much larger percentage of people that are vaccinated, but it might also be that the variants that we have now are more contagious, but not as virulent. So in looking at all of that, and also considering what it would take to issue a health order, as you know, especially when you are issuing an order that will impact the entire county, it's really heavily dependent on the individuals being compliant, because enforcement would be difficult. We, especially, for example, in public health, do not have the resources to go and check on every single person to make sure they're wearing masks. And I think you're all aware that at the beginning, we were able to do that to a large extent, but as time has gone on, I think compliance has gone down. When I look around right now, definitely there are people who continue to mask, but also it's usually the employees of a business that are masking. So looking at all that, and also the fact that vaccines are readily available, we are, unless there's a huge change in the number of cases or deaths, or hospitalizations, we're not anticipating that we will issue any such health order. So kind of a long-winded answer.
The current plateau, it's still comparable to, the Delta surge last year and other moments in the pandemic. And obviously the wintertime was the most pronounced this pandemic has been in California. But it does also seem that, like you noted, that this is a much more transmissible variant, and a lot of the immunity that has been built up over time, there's now reinfections. The boosters are starting to wane for folks who maybe got that first dose late last year, and now we're kind of at that that point where experts have said it's starting to taper off a bit. Do any of those factors play a role in maybe changing the calculus a bit? Whereas, obviously hospitalizations and deaths are obviously the thing we care about most, but transmissibility, reinfections, and the possibility that when schools reopen and life kind of picks back up in several weeks here, greater swaths of the population are going to be gathering. And a lot of the measures that maybe were in place, or the immunity that may have been there fresh off vaccines last year, isn't necessarily there now. Does that play a role?
It definitely plays a role in our consideration. But again, as I mentioned, even though we are seeing reinfections, and even people that are vaccinated are still susceptible to getting infected, but especially for those that are vaccinated, the severity of the disease is much less. And so again, considering, because in public health, we're always having to weigh the different options that we have, we feel that continuing with the strong recommendation is, especially with also being able to have a readily available vaccine, is the best option that we have right now.
Right now, you just can't go and enforce compliance like you were able to earlier in the pandemic. And I was wondering, what has changed about the enforcement? Are you seeing less compliance among, how is that enforcement being done, first of all? And second of all, why is it less now?
As I mentioned, especially with the level of the number of people that were affected by the health officer order, we are dependent to a large extent on people voluntarily complying. And so we saw that earlier on, because there was a lot of concern about COVID-19. They were hearing about the outbreaks, the deaths, and hearing stories from people that had been impacted by COVID-19. I think a couple of things have happened. One, of course, there is the fatigue. And then, as I mentioned also, I think there are more people that are getting a milder disease. And so I think that all plays into, their feeling that they need to do the masking. So I think it's like I said, the large part of it is being able to make sure that people can voluntarily comply.
You were pretty vocal at the beginning of the pandemic that you felt like certain areas of the county or certain areas of your own department weren't getting enough support from the Board of Supervisors and from county government. Do you feel like they're currently giving you enough support, or is there something more that the Board of Supervisors and county government could be doing to help with the ongoing health crisis?
Well, I'm certainly grateful that once the Board of Supervisors was made aware of our need for funding, that they did make sure that we had the funding we needed. And then subsequent to that, we have received additional funding from the state. So I think in terms of resources and support, we have that. It's just like everybody else, I think, being able to make sure that we have the people, because we need a lot of nurses, a lot of people with a certain skill set. And so I think that's where we're having the challenge.
It's kind of interesting that you described it as a strong recommendation, because I know that is the state's official position, although I don't think most people really think of it that way. When, once they dropped the mandate, they did say we still strongly recommend it, but I don't think that's necessarily the message that got across. Can you elaborate at all on, in your mind, what does that mean that the county agrees with the state and strongly recommends that people wear masks? How should people interpret that in the general public, and where should they be wearing masks? For example, what sort of situations should they be thinking of this as something that they should probably be doing according to the official health advice?
Well, yeah, you bring up some good points. I think one message that we try to bring across, one is to remind people that masks do work, and they are protective. And at this time, without having, or short of having a health order or a mandate, that just reminding people that we still recommend that people should be wearing masks, especially when they're out in public, especially when they're in places that are crowded, especially when they're using public transportation. And then also, I know that masks are still required in certain settings, such as in healthcare, and also in jails and homeless shelters. So I think it's definitely important for people to wear masks at those settings, but also in the others to think about it, especially if they're going to be in a group with a lot of people.
I wanted to ask you about monkeypox vaccines and their availability in Sacramento County. I think there's been some concern that the rollout has been mainly focused on the homosexual community instead of the community as a whole. And children now we're seeing are particularly susceptible to it. As they go back to school in August, as Yusuf mentioned, there's going to be, I think there's going to be a wave of cases as people, like you said, have some fatigue when it comes to mask wearing and general, the kind of hygiene that we've been, doing for the last 2 years or so. What is Sacramento County's plan to mitigate some of that? And can we expect to see more vaccines being made available to places other than just LGBT centers?
That's a good question. I think just to backtrack a little bit, with monkeypox, we do know that anybody is susceptible to it, but the outbreak that we have right now has been mainly focused or concentrated in the MSM, which is the men who have sex with men, which is in the LGBTQ community. And with the initial phase of our response, our effort was to mitigate the spread. And so definitely when you are dealing with limited resources, which vaccines, even though they are available for monkeypox, the supply is limited, we had to initially focus on identified contacts. And then once we started getting additional cases, we had to request approval to actually expand that criteria, and now being able to offer the vaccine to individuals that identified at increased risk, which is still within the MSM community. I think that as more vaccine is made available, we'll definitely talk with the state to look at being able to expand that. But right now, the vaccine is still limited. Sacramento County, we've received a total of maybe about 2,000 since this whole outbreak started. And we have either been able to redistribute that to our partners, or have held clinics and used up all of our vaccine. So we're not keeping any vaccine back. Whatever allocation we get, we're planning clinics and being able to offer that to individuals that fit our criteria.
So we've used about as much as we have in terms of the 2,000 vaccines?
In terms of clinics that we have had, and also redistribution to our partners.
when do you expect Sacramento County to receive more?
We don't know right now. That will be dependent on the CDC and CDPH. And I know that as soon as they get vaccine, they have been distributing it to the counties. So we have not been given a date for any additional, but we know it's coming.
Does World Health Organization declaration, do you anticipate that will change anything at the federal and state level for removing some of the barriers that it sounds like you're hinting at are at least in place in terms of monkeypox?
Well, my understanding is that the supply of vaccine is dependent on the manufacturer. And I think that the manufacturer is trying to ramp up and be able to provide more. A little bit about the vaccine is that there are two types, the ACAM 2000, which is the older type of vaccine that was given before for smallpox. But as you're aware, it's much more difficult to administer that one, and it does come with more severe side effects. So a lot of hesitation in using it. The advantage of it is that it's administered just like any other vaccine that we have, and so much easier for us to be able to use. And so far, we haven't had anybody with any severe side effects, so much better for us to use for this outbreak. But the supplies are limited, and so we're going to have to wait for the manufacturer to be able to provide more.
As far as the COVID vaccination, I know you said the county wants to keep it readily available, which it is. Is there anything else? Has the county exhausted its ability to? Are there any other tools to increase vaccine penetration that you're trying right now, or are we past that point? Is there anything the state and federal governments could do that you wish they would do to help you increase penetration of the vaccines?
I think with the initial vaccines that we got, we really were able to vaccinate people that were readily willing to get vaccinated. But we've gotten to a point where we're getting to people that are harder to reach, either people that have a lot of more hesitation about whether this vaccine really works, or hesitation about after hearing a lot of misinformation maybe. And so our effort is to continue to reach out to them. And the best way that we've been able to do that is with being able to use community-based agencies that already provide services and already have the trust of the community members. But we know that trust takes time, and it takes a lot more effort. So we're still continuing to hold clinics. They are small, but I think that with each time that we are able to vaccinate, that's at least a few more people that are vaccinated. So this is going to take longer, but I think we've come a long way. I think especially for the underserved communities, what we're seeing is a result of a lot of things. One, that they haven't had the access for a long time, and so finding ways of being able to provide them the access, and then also, again, being able to build that trust. There are many who either have not had any interaction with government agencies, or maybe they've had interactions with the healthcare system and maybe it hasn't gone that well. And so our job is to continue building on that trust and getting to the point where they're able to, take what we're saying and be willing to get vaccinated. I think and I think again there we are very dependent on being able to work with community leaders and community-based agencies that already provide services.
That was an issue that you and I had spoken about, I think, back in November, especially in underserved, diverse neighborhoods who have a historical aversion to trust in the government, rightfully so. Have you seen noticeable progress in getting those communities to vaccinate and boost, or do you feel like it's still the same struggle 6 months, 7 months later?
We've definitely made some progress. We knew that it would be hard work and it would be slow, but I think one thing that we heard over and over again is consistency. And it's not the same situation where we'll go and have just one clinic and expect that everybody will come and get vaccinated. It's going back again and again, building that relationship, and relationship takes time. I know that our connection with these communities has been strengthened with the work that we've been doing, and our goal is to continue building on that with the years to come.
So particularly at the beginning of the pandemic, there was a lot of resistance, not as much in our county, but other counties. We reported that in some counties, politics became involved and got in the way of public health officers. You saw resignations of some public health officers. How would you describe whether that is a challenge for you now in your job, and how much do politics come into play, factor into your decisions, and do you feel that you have to be responsive to the political climate regarding masking and vaccinations?
Well, in regards to the masking, we are looking at more of what the impact of any health order would be. It's not really a matter of what the political climate would be like. It's a matter of what factors we need to consider. But of course, I'm aware that some of the resistance to the vaccine is probably tied up with some political ideas that people have had, and somehow the idea about vaccination has been tied up with politics, unfortunately. But in my job, as much as possible, when I'm making my decisions, is looking at the facts and how I am able to help the communities that I serve.
So when you say you're kind of looking at the effectiveness of a mandate, can you explain sort of like what you're seeing? Because I don't want to, assume that like you're considering that maybe if you were to implement it, it wouldn't be effective. But if that's the case, could you just kind of detail a little bit as to what you're seeing if you were to do something like that?
Going back to what I had said about when we are issuing an order for a group that's, as the entire county, we are to a large extent dependent, one, on the businesses to enforce, and then also we're very dependent on individuals being voluntarily willing to comply. And I think right now, because of, I think the fatigue, there might not be as much of a willingness to comply as we were seeing at the beginning. So then that would mean that we would have to depend on the businesses to enforce compliance. And we know that that's been a challenge for many of them.
What would need to happen in order for the county to consider a mask mandate or some other measure that was we saw in the beginning of the pandemic, but not now? What would need to happen for essentially for you to change your mind from how you're feeling right now?
I think if we got into a situation where we were seeing a lot more cases and we were seeing a large increase in hospitalizations and deaths, that would make us rethink and reconsider being able to issue a mandate. And again, we work very closely with the state, so that's something that we would have to discuss with them as well.
What's your opinion of LA instituting the mask mandate? Do you feel like that was a good call?
I'm sure that they had different decisions they had to make, so I can't really assess because I mean each county has to make their own decisions.
Do you have any advice for someone who's, say, running an office or a store or, you know, any other kind of workplace in terms of what precautions they should have in place? Ideally, even though there are no mandates in that regard, should a workplace be asking everybody to wear masks or requiring everyone to wear masks? Should they be testing and checking vaccinations? Do you have any advice in that regard for business people?
All businesses, even now, do have the ability to implement additional requirements. So right now they can do that. They can require a masking. They can require testing. But of course, they have to be able to do the enforcement. It, to a large extent, does depend on the type of business. In general, I think my advice would be if they're seeing a lot of cases, especially among the staff, that actually Cal OSHA does require that they take certain measures, such as requiring masking and testing as well. But definitely, if they're considering it for day-to-day work, that's one thing they need to consider, is making sure that they're able to enforce it.
I know this has been a discussion for much of this year, but it's just about like the endemic nature of the pandemic, and if maybe we're getting to that. But do you feel like we're starting to reach that phase? Are we in a transition to that phase? I mean, how does the word endemic sort of hit you in this moment?
It's hard to say because usually endemic, you have to consider data for a period of time before you can say, okay, it seems like this is what it's going to stay like. Definitely, of course, my hope is that the numbers will go down before we get to that endemic phase. But I think one good thing about what we're seeing now is that it seems like people are not getting as sick as they were before. So we're getting towards that, but I can't really tell you when it will happen. I think it's something that we'll have to look back, hindsight, and say, okay, this is when we reach the endemic phase. But of course, it's dependent on folks at the CDC level that will have to make that call.
How long are we going to have to be concerned about this? Because I didn't have to be hospitalized, but I didn't feel good either. And that was, it was not a pleasant experience in any way. And thankfully, I benefited from taking Paxlovid, which really helped me. But it was very unpleasant. And so I just wondered, I know I'm sure you get asked by people all the time. It's like, how long are we going to be living this way? What's your best answer for that question?
I guess my best answer is that the virus will determine. I think you've heard that from the CDC level and from Dr. Fauci quite a number of times, because so long as there are people that are vulnerable to severe disease and to death, it will be one of our concerns. And so we just have to continue. And thank you for mentioning the Paxlovid. I think the availability of treatment is also another reason for us to be able to leave the option of the making the risk assessment to the individual as opposed to issuing a mandate across the board.
Were you surprised at how quickly monkeypox has spread from being something that we just began hearing about, and all of a sudden where we are now. Was that surprising to you?
It's something that we always have to be prepared for. I think knowing how it is transmitted, a major concern for us was that maybe some people were getting exposed and didn't know, or that people had symptoms and were showing up at healthcare centers or hospitals, and they weren't very quickly recognized. And of course, that contributed to it being spread. I think, and I have to point out that right now we still consider that the risk to the general public is low. And so I think it's really important for us to be able to make sure that we stop the spread so that it doesn't get into the general public, because right now we know who is at risk and we're able to target them. Definitely our hope always is that we'll be able to stop it quickly. And if you recall, when we first got our first cases, we through contact tracing, we were able to stop it at that point. And we went for about 3 weeks without cases, but we know that people travel to different places. And now what we're seeing is individuals that are exposed not to just one person, it's exposures at different events. And so that's a little more challenging to control. And I think that's why we're seeing more of an increase now.
Is there anything you're hopeful for, or something you want people to know?
Oh gosh, my hope is that, you mean related to monkeypox?
Related to COVID or monkeypox, or the future of compliance, or the end of the fatigue, anything?
Well, I think my encouragement to people is that at some point we will get to the end of this. Definitely all of us hoped that would come much sooner. I think when we got our vaccinations the first time, we started seeing cases go down. We were all thinking, yay, because that's what happened when we had the H1N1 outbreak. But unfortunately, as we know with viruses, they do mutate. And unfortunately, we're still in this situation. But I think I would encourage people not to give up, because at some point we will come to the end of it. I don't know when that will happen, but I think for every single person where we're able to prevent disease, it's important. And that's why we continue to do our job. So, my hope is that, this will all end soon and people will be able to get back to their regular lives. But I also know that viruses can be difficult because of their mutation. So we have to keep going.
If I could just kind of go back to one more COVID item, how much do you or your office look at long COVID symptoms and experiences? Is that something you or your office are tracking?
We are not. I know that UC Davis does have a clinic where they are tracking long COVID. And so definitely looking forward to some of the data that they'll be able to provide to us. But with the nature of the work that we do, it's basically to try and prevent or stop outbreaks. So after that, with long COVID, those are followed up at the clinic, so we don't get to interact with any of those individuals.
What's been the hardest part of this experience for you? Was there a particular period in the pandemic that was especially challenging?
I think the beginning was challenging. And of course now, because it's gone on for so long, but what was challenging at the beginning was when we got to the realization that this was much bigger than we thought it would get to, and getting to the point of having to issue health officer orders because, I was getting some of the phone calls of people that were impacted by this, and it's not easy to listen to how people are impacted. But at the same time, I was also getting phone calls from people who had lost loved ones and finding out how their lives had changed. And I think those are the memories that I think will remain with me because, it's had a huge impact on people's lives. Right now, people look at the numbers, and I think it's easy to forget the lives that have been changed by this disease.
Doctor, thank you very much. It's good to see you, and wish you good luck, good health.
Thank you.
I'm feeling very happy because I feel back to abnormal again. So as opposed to having COVID. So I thank you very much for your time. And I look forward to seeing you again.
Well, I'm glad you're feeling better, and I hope all of you will remain safe.